I'm going to do something that I don't normally do, but there's a really good reason why. I'm a board certified general pediatrician, so I follow evidence based medicine. I love vaccinations, preventative measures, all of those things. I recommend them for all my patients. I am not, as some doctors on here, vaccine neutral, okay? However, they're the only ones that are giving advice to families who are not going to get some of these vaccinations. And so, if they already don't follow the science, I want to make sure you hear it from someone like myself who actually treats kids with these conditions. So, let me give you some advice. First of all, I'm sorry that you're in this position, that you feel that preventative measures like this are dangerous. I really do empathize. I can't imagine what this feels like. And as angry as I get sometimes, it's never at you guys. It's at the institutions and things that allow this to happen, the people that are grifting on it, including people on my side, okay? So the first thing I want to talk about is what are things that you can do to try to minimize your baby's risk for hepatitis B at birth if you're not going to give the vaccination, because everything is about probability, right? The first thing is make sure you yourself are vaccinated if you feel comfortable. Most of you already probably are if you're of childbearing age, because it's been over 30 years and it was pretty widely accepted for a long time. So most of you probably are vaccinated. However, ask your doctor to check your titers before you conceive. So you can see, did you mount an immune response to the hepatitis B vaccination? Also get your partner's titers checked as well. Make sure both of you have a good response, because the two ways that you yourself can infect your baby is during birth. And then after birth, if you're positive and you don't know it, you would never know how to protect your baby. So make sure that you're vaccinated and that your titers are elevated and at the normal amount for someone for hepatitis B protection. It needs to be both you and your partner. The second thing is during your first trimester, make sure that you get prenatal care and that they do the hepatitis B testing during that first trimester. Also ask your partner to get one as well, because that gives you your best chance, because the test is 1 to 3% of the time going to be negative when it's really positive. It's a good test. It's just not 100%, and we want 100%, right? So you get a test and also your partner. You need to let the person who is doing your obstetric care know that you're not planning on giving the hepatitis B vaccination at birth, because they're going to need to do testing in your third trimester to make sure that you are still negative. Again, they're just going to offer it to you. Your partner also needs to be tested again as well to make sure that they didn't contract it during your pregnancy, because you don't always have symptoms. It's a pretty asymptomatic infection until it causes liver issues. When the baby is born, you obviously let them know you're not going to give the hepatitis B vaccination, but also I want you to decline a circumcision. There's blood involved, so I don't want you to get a circumcision if your child is not protected from hepatitis B, because all the things you just did only protect them from coming through the birth canal or mixing of blood of baby and mom. Don't get them circumcised. Don't get their ears pierced, and make sure that you let every single person that's caring for them know that they've not had the hepatitis B vaccination. Make sure all caregivers are protected from hepatitis B. Ask them to get their titers checked as well. Again, a lot of this may not be covered by insurance, but it's worth it. If you want to get them vaccinated, starting with the routine vaccination schedule at 2 months, that really starts to cover them for all the other exposures in life. If you don't, we can do another video about how to try to protect your baby after 2 months of age. But those are just some tips that I would give you, because I don't care what your philosophies or beliefs are. I really only care about kids not getting hepatitis B, and this could take a decade or so to really start to see the ramifications of it. So we need to all start thinking ahead of time now. I'll do some other videos like this where I talk to you about, if your child is not protected from other vaccine preventable illnesses, what are some things that you can do to keep them as safe as possible? Again, I am not vaccine neutral, but I care about your kids, and I'm the one seeing them in clinic every day when they get sick, and I want you to feel as prepared as possible. Take care out there.